Hello students, you are welcome to today's lecture. I'll be taking you through a quick tour on the concept of primary healthcare. Moving to the introduction, primary healthcare focuses on disease prevention and health promotion. It is a type of healthcare delivery sometimes described as by the people, of the people, and for the people, just like democracy. It involves the community in the whole process of healthcare and encourages them to maintain their own health. The role of health extension workers and practitioners is to work with the community and help them acquire the knowledge, the skills that enables them to ensure their own health. At the end of this lecture, I'm very sure you'll be able to understand the principle guiding primary health care. When you have studied this session, you should be able to define primary health care with its keywords. You should be able to explain the various approaches to primary health care and should be able to highlight and explain the various components of primary health care. What is primary health care? It is often abbreviated as PHC, and it has been defined as an essential health care based on practical, scientifically sound and socially acceptable methods and technology which is made universally accessible to individuals and families in the community. It is through their full participation and at a cost that the community and the country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. This ideal model of healthcare was adopted in the Declaration of the International Conference on Primary Healthcare held in Alma-Ata, Kazakhstan in 1978, which is known as the Alma-Ata Declaration, and it became a core concept of the World Health Organizational goal of health for all. Looking at the background of the primary health care, it can be traced back to the barefoot doctors of China. They were an important inspiration for primary health care because they illustrated the effectiveness of having a healthcare professional at the community level with community ties. Barefoot doctors were a diverse array of village health workers who lived in rural areas and received basic healthcare training. They stressed rural than urban healthcare and preventive rather than curative services. They provided a combination of Western and traditional medicines. They had close community ties and which were relatively of low cost, and perhaps most importantly, they encouraged self-reliance through advocating prevention and personal hygiene practices. What are the goals of primary health care? The ultimate goal is health care is better health for all. Better health for all. The World Health Organization has identified 5 key elements to achieving that goal, which is better health for all. 1. Universal coverage reforms by reducing exclusion and social disparities in health. Another thing is service delivery reforms that includes organizing health services around people's needs and expectations. We also have the public policy reforms that involve integrating health into all sectors. Then we have leadership reforms that include that means that pursuing collaborative models of policy dialogue. Then we also have increasing stakeholder participation. What are the principles of primary health care? The primary health care policy has 5 key principles that has been designed to work together and be implemented simultaneously to bring about a better health outcome for the entire population. The first principle is accessibility, which means universally available healthcare delivery regardless of the geographic location. And the second principle is public participation, which encourages the community to participate in making decisions about their own health, identifying their own health needs and finding solutions to their health problems. The third principle is the principle of health promotion that involves health education on subjects such as maternal and child health, immunization, nutrition, sanitation, and control of endemic disease. The fourth principle is the principle of appropriate technology that emphasizes those technologies that are scientifically sound, cost-effective, and feasible to be introduced into the community. The fifth principle is the principle of intersectoral collaboration that emphasizes integrated work with other sectors, such as the Ministry of Agriculture and the Ministries of Education, Housing and Water Resources. In sum, primary healthcare recognizes that healthcare is not a short-lived intervention, but an ongoing process of improving people's lives and alleviating the underlying socioeconomic conditions that contribute to poor health. What are the approaches towards primary health care? Many argued the declaration did not have clear targets. Many argued it was too broad and was not attainable because of the cost and aid needed. As a result, primary healthcare approaches have evolved in different contexts to account for disparities in resources and local priority health problems. This is alternatively called the selective primary healthcare approach. The idea of selective primary healthcare approach was introduced as a strategy to complement comprehensive primary healthcare. It was based on a paper by Julia Walsh and Kenneth S. Warren, which was entitled Selective Primary Healthcare, an Interim Strategy for Disease Control in Developing Countries. And this new framework advocated a more economical, feasible approach to primary healthcare by only targeting specific areas of health and choosing the most effective treatment plan in terms of cost and effectiveness. Gobi FFF approach aims to prevent most health and nutrition problems before they begin. It stands for growth monitoring, that is, monitoring of how much infants grow within a period with the goal of understanding needs for better early nutrition. The O in Gobi stands for oral rehydration therapy that needs to combat dehydration. B stands for breastfeeding, I stands for immunization. The first F stands for family planning, the second F stands for female education, and the last F stands for food supplementation. Some jurisdiction applies primary healthcare principles in planning and managing their healthcare services for the detection, diagnosis, and treatment of common mental health conditions at local clinics and organizing the referral of more complicated mental health problems to more appropriate levels of mental health care. And that addresses the primary health care and the mental health. There's also another approach of the primary health care and population aging. Given global demographic trends with numbers of people aged 60 and over expected to double by 2025, primary healthcare approaches have taken into account the need for countries to address the consequences of population aging. They need care. What are the components of primary health care? One is public education and participation regarding prevention and control of health problems. There's promotion of food supply and proper nutrition for everyone. There's adequate supply of water and basic sanitation for everyone. We have comprehensive maternal and child health care, which include family planning. We have global immunization against major infectious diseases. We have prevention and control of locally endemic diseases. We have appropriate and accessible treatment of common diseases and injuries. And last but not the least, provision of essential drugs to all. With this primary health care, with how good it sounds, there are still some criticisms of this primary health care. From the models that we have discussed before, the best known model was the selective primary health care approach, and the selective primary health care favored mostly short-term goals and targeted health investment, but did not address the social cause of death. As such, the selective primary healthcare approach has been criticized as not following the hammer-attack's core principle of everyone's entitlement to healthcare and health system development. Thanks for listening. I hope to meet you in the next study session of this module. Bye for now.